Okay, first thing I need to say is that yes, your kidneys kind of sit in the back, okay, like kind of like this. I don't know if you guys can see, kind of in the back, the flank. But if you have flank pain, it doesn't necessarily mean you have a urinary tract infection or a kidney infection. I do every now and then have patients come in saying, I have pain back here. What's back here? My kidneys. Maybe there's something wrong with my kidneys. Not necessarily, but of course, any pain you should always be getting checked out. Guys, today we are talking about the symptoms of a urinary tract infection because this is really important, and they can be actually relatively common in some people. Women tend to get them more than men, but you really should know what the symptoms are. Now, a little anatomy, guys, okay? This is sort of the urinary tract. Urinary tract consists of urethra, the bladder, the ureters, and the kidneys, all right? You can have an infection anywhere along this tract, and sort of where you have the infection sort of dictates the symptoms, okay, in some ways. Also, I have another video, by the way, on why women tend to get urinary tract infections more than men. It has to do with that short urethra at the bottom that women have. So keep that in mind, okay? But let me just sort of explain here, okay, what we've got going on here. Symptoms of urinary tract infections. When we're talking about like a simple cystitis, like a bladder infection, the infection's kind of in the bladder. What are we talking about? What kind of symptoms do we get? Well, we can get symptoms such as pain or burning when you urinate. Who's ever had that? Or new or worsening urinary urgency. You're probably saying, well, what does that mean? Well, that basically means like the minute you feel the urge to go to the potty, you gotta be in the potty, okay? You just feel like the urge and you gotta go. So that urgency can be a sign of a urinary tract infection. Also, incontinence. Sometimes people become incontinent with this, or what we call frequency. That means needing to go frequently, like you just went to the potty, but like 5 minutes later, you gotta go again. Sometimes people experience a little bit of blood in their urine, okay? Blood in your urine should always be evaluated, always, 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 okay? And then many people get what we call suprapubic pain in sort of the lower pelvis, sometimes even a little bit in the back. You can get a little bit of back pain, but that sometimes goes into more upper tract symptoms. Now, I should say, and I did say this before, women do get more UTIs than men. So the symptoms that I'm describing are often the symptoms that women get. Why? Because women tend to get more UTIs than men. I have a video on why this happens. So check that out. DM me if you want that one as well. Okay. So those are many of the symptoms if the infection sort of localized to sort of the bladder, etc. But if the infection sort of goes up the tract and extends beyond the bladder, you can get worsening symptoms. You can get some of the symptoms I mentioned, but you can also get things like fever. You can also get nausea or vomiting. We call them sort of systemic symptoms. You get chills. You can get really, really fatigued, like not normal fatigue. You can get flank pain. That is where you get that pain sort of in that back, in your back, or something that we call CVA tenderness, costovertebral angle tenderness as well. If the urinary tract infection spreads up to the kidneys, yeah, it can be very, very severe. So as you can see that there's a range of symptoms that one can have when it comes to a urinary tract infection. Some of that has to do with there's just a number of places throughout the urinary tract that one can have the infection. Also underlying factors, who you are, your underlying conditions, etc., plays a role. But I'm interested to know, that's sort of a quick and dirty overview of like urinary tract infections. I want to know, have you ever had a UTI? If you have, what have been your symptoms? You know, is it something that you deal with? Also, please share this video with other people. Hopefully it will be helpful to them. I always say, like, if there's any, the other thing I didn't mention with like a bladder infection, some people get foul smelling odor. Sometimes the odor, like it just has a foul smell. And then sometimes also it looks different. It may be like a little cloudy, or it might be like just a different color, not like a strong color, but just like it just looks different than your normal urine. So that's something that often happens too. But again, there's a range of symptoms. Not everybody gets all of these. Let me know what you think. Let me know if this video was helpful. Please share it with anyone you think might benefit from it. I'm Dr. Jen. On Facebook, please like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. I do daily videos and all sorts of stuff. Consider subscribing to my my subscription groups where I have exclusive content on YouTube and Facebook. Also, I'm on TikTok and Instagram as well. Go to my website, drjencaudle.com, so you can be updated with my free health newsletter. So I'd love you to sign up for that. All right, guys. Love y'all. Talk to you soon.